Racial and ethnic minorities are less likely to get screenings, including vaccines. And a lot of these are free. So theoretically, even if you don't have insurance, you would be able to access them. Or if you have basic insurance, they're covered under the law.
Right.
What can be done to encourage more populations to get the life-saving screenings that are available to them?
So I think there's a lot of controversy around vaccines when there shouldn't be across all populations in this country. It's quite frightening. Going back to how patients receive information and who they trust is a key place that we need to intervene on. So, for instance, if I have several patients who all live in a community who don't want to get any vaccines, but they all go to a certain church, or they go to a certain social setting where there are people who they trust, who actually do believe.
An influencer.
An influencer.
Yeah.
Perfect. So that's the kind of person, again, this is us going out to the community. This is us reaching out to the patients writ large in an area where perhaps they never had that kind of outreach, that kind of penetration. And using the influencers is a great term here, because that's what they are. Be it community health workers, which we've been using at Cornell to better understand what do these patients think about vaccines, think about colonoscopies, think about mammograms. What are their barriers? Can we get through those barriers? What is it about their values or preferences? Some people think that, well, if I get this test, I'm going to actually get the cancer.
Right, because it's got radiation in it.
Right, exactly. Even if it's got a minimal amount of radiation. Or if I get this vaccine, you know, again, this cuts across all socio-demographic strata. There's a lot of fear about vaccines. But whether or not there's a particular cluster of fear in a community, it's our job to try and find those influencers in that community to work with and meet them halfway.
Yeah.
You know, to be flexible about your own bias and say, all right, even though I think I know the best and I know that this is right and that all of your thoughts about this don't make any sense, I still need to know where you're coming from. Otherwise, I'm not going to make any headway.